But what needs to happen, and I was talking to a couple people today from different countries, and they even went to what they call integrative oncology centers, alternative holistic oncologies, and no one asked them about their mouth, their dental health. I find that shocking because I mean, you don't have to go to medical school. You don't have to go to nursing school. You don't have to go to school at all to know that the mouth is in the body. Now, we have a tube called the gastrointestinal tube. It's our intestines. That tube begins with our lips and it ends with our anus. That's it. It's 30 feet long or 10 meters, however you want to look at it. Attached to it are things like, it's got things hanging off it like liver, pancreas, things like that. But that's the tube. Starts out as lips, mouth, then you have the mouth and all the things in there, and then it goes through the esophagus, to the stomach, to the intestines, to the colon, and out. All right? That's the tube. And the purpose is one thing only: to extract, to obtain, and to assimilate and use nutrients and energy. That's the purpose. Now, the mouth plays such a fundamental role in all of that. How do we why are there two professions? Dentistry and medicine. Why? Yeah, how did the mouth leave the body? I don't know. But we don't learn it. Doctors don't learn it. And it's incredibly important. I mean, your bite is at the top of your spine, the top of your spine. And if your bite is off, your entire spine is off. We've also, when you're born, babies have soft spots, right? Well, that's because when you're born, you've got the bones of your skull have not fused yet. The reason they didn't fuse is because they needed to be pliable and movable so the baby could be born. There's a lot of pressure on the baby's head pushing down on the mother's cervix from the inside, and the mother is going through a lot of pain, but so is the baby. You can imagine its head is being squashed. So anyway, so when we come out and we're born, how could it be possible that there won't possibly be some things out of that aren't quite right, that won't fuse together won't fuse together perfectly. And that has an effect on the position of your jaw, your temporomandibular joint. It affects your cranial nerves, which deal with everything from, vision and smell, tongue, swallowing, lots of stuff. So your senses, if those cranial bones are maladjusted. So that's why you may have all heard of cranial sacral therapy, right? Sacral refers to the sacrum, which is the bottom part of the spine, and the cranium is the top part, and to bring those into harmony. But a lot of people don't. Medical, they ignore that completely. And then the other major problem, that's probably more major, is that the regular dentists, know nothing about that. They don't think about that. They would do weird things like put in root canals, and they extract teeth without making sure the periodontal ligament is out, and they leave fragments of it. Then they don't actually close it up. They leave it open. It gets colonized. You wind up getting cavitations above certain meridians. So you can't take care of someone medically, especially if you've got chronically fermenting cells, if you haven't taken care of the mouth. If you've got a cavitation because of a failed extraction or whatever, over your prostate meridian, and you have chronically fermenting prostate, it doesn't matter what you do. It won't get better until you fix that. If it's over your breast meridian and you have chronically fermenting breast, if you don't take care of that, it doesn't matter what you do, it can't work. Colon, small intestine, doesn't matter, pancreas. And in cases, I've had several cases where just taking care of the teeth and everything went away.